This is Dr. Paul Aschinberg, and today is July 5th. It's been about a month since I did my last post, and since then, unfortunately, the news regarding coronavirus cases has not been very good. If we review the chart on new cases of coronavirus in the United States, we see that after a sustained lull and flattening of the number of cases over the last month, we have seen a dramatic increase in the number of new cases of coronavirus. And most of this is occurring in the South, and in particularly Texas, Florida, and Arizona have been quite hard hit. In fact, Texas and Florida account for about half of this rise in new cases. Now, some people have tried to dismiss this rise in cases as just being due to the fact that we're doing more testing, or to the fact that we had the protests, which may have caused an increase in cases. But unfortunately, I don't think those are the causes, and we'll go into that a little bit as to why it isn't just increased testing or perhaps the protests. In terms of increased testing, it is true that we are doing a lot more testing now, and that in theory, we could be catching a lot more people now because we're testing more that are never really going to get that sick, are never going to end up in the hospital or passing away. And these are people who we might have missed back here in March and April when we weren't doing so much testing. So in some ways, looking at the cases now and back here is not comparing apples to apples. One way to try and tease that out is by looking at hospitalization rates, because even back in March and April, we did have enough testing to test most people who were ending up in the hospital. And so that would be a sign to see if this peak is just from more testing of people who weren't going to get that sick anyway. If that were true, then we should not see an increase in hospitalizations. So let's take a look at those numbers. This is the chart for the number of hospitalizations due to coronavirus. And as we see in March and April, as the cases were going up, the hospitalizations were going up, and then they also peaked and were going down, and then they're starting to go up now too. Now, this rise is not as dramatic yet as the rise in the number of cases we saw in the last chart. But that's because hospitalizations always lag a week or two behind the number of new cases. Because first, people get sick, they go to their doctor, they get tested, and then if they test positive within a week or two, most people will luckily get better and be on the mend. But a week or two later, a few people get much sicker and end up in the hospital. And so that's why this is not as high yet, because the number of hospitalizations do track a little later than the number of cases. But we're seeing exactly what we would expect to see if the number of cases was real and not just due to more testing. We're starting to see that a week or two after that peak in cases, we're starting to see the rise in hospitalizations. And in fact, in some counties in Texas and in Arizona, the medical system is already at full capacity. There's a couple of counties in Texas where they're having to helicopter people out who are sick to other hospitals in the state because they're already close to becoming overwhelmed. And in fact, those counties have actually called for their citizens to start sheltering in place again. So this is a big step backwards when it comes to how things are going there with coronavirus. Now, some people also chalk this up to the protests, and now that the protests are over, that things will start getting better. But again, when we look at that explanation, it just doesn't hold water. The reason is that many of the cities with the biggest protests, like New York, Chicago, Minneapolis, Washington, D.C., are not seeing this spike in cases. These spikes tend to be more in the southern states, and even in southern states that didn't have very big protests. Aside from that, when they really looked into what was going on during the protests, even though there were a lot of people out marching, a lot of people stayed home because of the protests and did not go out. They kind of almost went into lockdown for a while because they were afraid to go out during the protests. So when you look at overall mobility of people and social distancing, the protests didn't change that much because the people who were out, while there were a lot of people out, there were a lot of people staying in, and the protests were also being done outdoors where it's harder to transmit the virus. So the effect of the protests has not been that large. So why did this happen then? Why are we seeing this increase in cases? Did it have to happen? Is this just part of the natural evolution of how coronavirus is going to be? Well, to answer that question, we can take a look at how coronavirus is doing in other parts of the world. This is a graph comparing the cases in the United States to the cases in Europe. And this red line is the cases in the United States, which is basically the same chart I showed, the first chart I showed. And the blue is what happened in Europe. Now, we were about 2 weeks behind Europe. If you see, Europe started going up, and then 2 weeks later, we started going up. And then Europe peaked, went down, had another little second peak, and then went down. And we did almost the same. We had our peak, went down a little, had another little peak, and then started going down. But then something very different happened after that. Europe continued to go down and track off, whereas we leveled off and are now seeing this big jump in cases. Why is this? Why is there such a difference there? And the answer to this question is really in how seriously people take the recommendations to stay indoors and not go out as much, shelter in place, wear masks, social distance. In Europe and in other parts of the world, Canada is very similar, parts of Asia, people really buy in to these ideas. There's no other country in the world where wearing a mask is seen as some sort of sign of tyranny or weakness or the government taking over. The use of masks in other countries is very well accepted, and they're being used a lot more than in the United States, for example. And that is what's really accounting for these big differences. And in particular, these states in the South that have had the big increase in cases, they're all states that had short lockdowns. They locked down later than other states, and they also opened up much more quickly than other states. I'm talking about states like Texas, Florida, Arizona. Some people point to California and say, well, California locked down early and opened slowly, and they're seeing a spike in their cases. And that's true. But even California is huge. California has more than twice as many people as 48 other states in the country. They're just huge. And even though they're seeing an uptick in cases, when we look at the number of cases they have per their population, they're still way less than the other states. For example, Florida has half the number of people of California, but they're having thousands more cases a day. And so even though California has seen an uptick, because they're so big, a small increase in cases in California leads to big numbers. But when we control for population, they are doing better than the states that opened up very quickly and had a short lockdown. And so that's really what's accounting for these differences. Just to look at mask use, for example, which I know is still a bit controversial. As more and more data comes in, we see that using a mask decreases the rates of coronavirus. This is a graph where they plot each state based on how much people use masks. And so over here are the states where you don't get a lot of mask use. And as you move forward, it's states that use masks more and more. And you can see that the states where there's more people using masks, the rate of coronavirus goes down. And this is the use of masks is only controversial here in the United States, and that not buying into these efforts is what's causing some of this increase. Just to prove that point one more time, this is a colored graph of how many people are using masks. People were asked, have you used a mask even once in the last 2 weeks when you go out in public? And all this light blue here is less than half, meaning in most of the country, less than half of people have even used a mask once when going out into public. And in fact, even this darker blue color like Illinois, this is right about at 40 to 50%. So these are just half of people. Only the darkest blue is over half. And so most people are still not using masks when going out in public. And so that's the concern. Now, here in Illinois, we're still in relatively good shape. This is the number of cases here in Illinois. You see, we peaked, we came down, and now we've leveled off, and we still have relatively low cases. We need to take what we're seeing in these other states very seriously. As new data comes in, we have to see that we ourselves are also at risk of seeing another increase, of having to be shelter in place again if we don't take social distancing, wearing masks more seriously. I myself, once we moved into phase 3 and 4 and things started opening up, went out to eat once at a restaurant that had outdoor dining, started getting together with friends here and there, even took a little trip out of state with the family. Now, we drove and we stayed with family, so we weren't going to hotels or airports, but we started kind of going out more and more. As I see these numbers, though, I'm going to cut that back. I know restaurants now have dine-in options. I don't plan on going to dine in at any restaurants. I plan on doing more takeout, and even the outdoor dining, try to limit. Maybe instead of seeing friends once or twice a week, maybe cut that back to once or twice a month. Really try to focus on the more important things and limit some of what I was planning on doing after seeing what's going on in the southern states, where people really did open up much more quickly. And for those people who are concerned and who complained about the government locking everything down, and who maybe didn't agree with the way Governor Pritzker kept the lockdown going and opened up slowly, I would urge you that the one way to keep it out of the government's hands is for us to do our part. Don't go out as much. Wear masks when you do go out. Be smart about it, because that way the government will be able to stay out of this completely if we do our part and keep these numbers down. So I urge everyone to not let your guard down, especially with what we're seeing. Now, another hot topic that many people asked about were school reopenings. There's been a lot of talk about reopening schools. The governor in Illinois said that we should move towards opening schools in the fall. The American Academy of Pediatrics also recommended opening schools in the fall, and there's been many questions about this. I do agree with the plan that we should reopen schools in the fall. And this may seem like a bit of a contradiction if I'm saying that we need to be careful and maybe not go out as much now, but I'm saying that we should move forward with opening schools. But it's really not a contradiction, because I think we have to prioritize. Going out to dinner, getting together with friends, for me, that's not nearly as important as getting kids back in school. For children who were in school before the coronavirus pandemic, we should try to get them back in school. Most people who experienced e-learning with their children for a few months quickly realized that this is not as good for their education as actually being in school. And there's a lot of other social and mental health benefits to kids being in their routine and going to school. And again, even the secondary effects of allowing parents to go back to work because they're not at home having to take care of their kids. I've had a number of patients where one of the parents, and it's usually the moms, had to stop working because their kids were now at home. And so I think being in school is a priority. I think this can be done safely, certainly safely for the children. Many studies across the board, it's now pretty much certain that kids just don't get affected as severely with coronavirus at all as older adults do. And so healthy children are at extremely low risk. There's even some data that shows that kids aren't very good at passing coronavirus to adults. In countries where they didn't close the schools, there are still more adults giving coronavirus to children than children giving coronavirus to adults, which is completely different compared to colds and flus, where kids pick it up at school, come home, and then get the whole family sick. When it comes to teachers and staff at schools, I think just like doctors, nurses, EMT workers, we are all going to work to help the community, and I think schools really are an essential part of the community as well, and that they can go back if some safe steps are taken. And it's not going to be perfect. Not all kids are going to keep their masks on all day, but I do think there are ways to return to school responsibly, and I think that should be our goal in the fall. A couple of other questions that came up were some people had read that there's not as much of a need to wipe things down anymore, that you really don't catch coronavirus from touching surfaces with it on. And certainly that is true. The data shows that even though you can swab and test and find coronavirus on surfaces, that is not a major way of you catching it. And so, for example, I think if you go to the grocery store, you do not need to now wipe everything down. I think it is important, though, for you to wash your hands as soon as you put everything away. So try not to touch things and touch your face, put things away, and then good hand washing before and after handling these items, I think, would be very reasonable. Another question that came up is that there was some talk a couple of weeks ago that there were studies that asymptomatic people with no symptoms, really can't pass the coronavirus around. And so is it safe to be around people who had no symptoms? Now, this is where, unfortunately, scientists sometimes are very nitpicky with how they use terminology. In that study, they defined asymptomatic people as people who had coronavirus and never developed symptoms. And they separated those people out from what they called pre-symptomatic people, who were people who had coronavirus, had no symptoms that day, but a few days later, we're going to start getting sick. And it is true, people who never have symptoms don't pass it on as well. But people who don't have symptoms yet, who are going to act sick in a few days, they do spread it quite a bit. And the problem there is you don't know if someone you're with who has no symptoms that day has it, and whether they're going to have symptoms a few days later. So people without symptoms can certainly pass coronavirus to you. Now, people who are asymptomatic and never will have symptoms are at less risk of that. But that study really didn't clarify that very well and created some confusion. So no, you cannot assume that people with no symptoms are safe and cannot pass on coronavirus to you. So I hope that answered some of the questions that we've received over the last few weeks. As always, please keep the questions coming. And as new data is available or more questions come up, I will certainly post again. Until then, please be well and stay safe.